Hello, I'm Priscilla Meehan, Community Relations Manager for Legacy Community Health. For many of us, springtime and spring weather comes as a rise in seasonal allergies, especially for children. Today, I'm talking to Dr. Justin Lantz about ways to help your young patients breathe a little easier around this time. Thanks for joining us.
My pleasure. Thanks for having me, Priscilla.
What are seasonal allergies?
Your immune system may identify things like pollen or mold as dangerous invaders, and then it creates antibodies in an effort to help locate and fight off these allergens. Those antibodies can trigger histamines and other substances in your body that cause all our allergic symptoms.
Why are allergies so common during the warmer weather months?
When spring comes, the plants bloom and they release lots of pollen. That's great for the plants, but bad for our allergies. So seasonal allergies in the spring are usually triggered by tree or grass pollen, and then in the fall, triggered by weed pollen or ragweed. According to the Houston Health Department, oak pollen is actually off the charts right now, and that causes many of the allergic symptoms that kids and adults are currently having.
What are some symptoms of seasonal allergies?
The ones that people tend to notice most are allergic rhinitis symptoms. So runny nose, lots and lots of dripping. You may see your child doing that over and over again. Kids get lots of sinus congestion. They may develop what's called postnasal drip, or when all that mucus runs backwards instead of forwards and causes irritation in the throat. Kids may clear their throat a lot, or they may develop a little bit of a cough. Sneezing is also very common, as is itchy, watery eyes.
How can parents differentiate between an allergy symptom and some cold-like, flu-like symptoms?
Unfortunately, they all can have many of the same symptoms. If your child develops what seems to be a cold at the same time every year, say right around now or in the fall, it may be that the seasonal allergies are to blame. One key differentiator is that allergy symptoms usually come on suddenly. So if you notice that your child goes outside and plays around and suddenly starts sneezing or having itchy eyes or runny nose, it's probably the allergies that are to blame.
What are some ways parents can help treat their children's seasonal allergies?
Unfortunately, we can't avoid the pollen in the air. It's kind of everywhere, and kids love to go outside. When the pollen's around, we can do things to minimize exposure. When you're inside, keep the windows closed, keep the air conditioning on, and keep all of that outside air with the pollen in it from blowing inside. Additionally, it's a good idea for kids who suffer from seasonal allergies to try to wash or shower off as soon as they come inside to get rid of that extra pollen that may be stuck to them and causing continued symptoms.
When should parents seek medical care for their children's allergies?
Children, especially those with allergy symptoms for the first time, should definitely see their legacy pediatrician for a diagnosis. Once a child has been diagnosed, there are lots of treatments available. We often use over-the-counter medicines or prescription medicines to help control the allergy symptoms and to keep your child nice and comfortable. Because the over-the-counter medications will have different doses for children as compared to adults, it's always a good idea to check in with a pediatrician before you give any of those medications yourself. A legacy doctor will also be able to determine if your child has any conditions associated with allergies, such as asthma. If you'd like to schedule an appointment, you can visit our website at legacycommunityhealth.org or give us a call at 832-548-5000.
Thank you so much, Doctor, for answering our questions today about seasonal allergies. I hope this brings a big relief to a lot of children and families this time of year.
I hope so too. My pleasure, and we hope to see you here in the clinic soon.